They are experts at how to develop and implement patient-centered care in healing environments. You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Dr. Susan Frampton, President of Planetree, a leader in the patient-centered care movement located in Derby, Connecticut. Dr. Frampton, welcome to the Clinicians Roundtable.
Thank you. It's wonderful to have a chance to talk with you today.
Tell us about Planetree.
Well, Planetree is a unique organization. It's a nonprofit that was founded by a single patient 30 years ago. And so there's a really compelling story behind it in that this patient was admitted to a large hospital and had a very typical experience in the hospital. She was there with a life-threatening fever of unknown origin, spent about a week or so, had every test known to medical science in the 1970s done to her. And she came away from that experience basically saying, the clinical side of the care was, of course, superb. But she said from the perspective of a human being, it was a horrible and horrifying experience. She just felt it was such a cold institutional environment, lots of things being done without good explanation or communication. And she's an interesting woman in that she was born and raised in Argentina, and she said, if I ever got really ill again, I'd prefer to go back to Argentina, where even though the care may not be as sophisticated, you're treated like a human being, because she felt it was that important. And that experience led her on this crusade to really help hospitals and clinicians to look at things from the patient's perspective.
Where did the name Planetree come from?
Well, the name Planetree actually goes back to the roots of modern medicine. Hippocrates, the father of modern medicine, is said to have sat out under the shade of the plane tree or sycamore tree on the Greek Isle of Kos when he taught the very first medical students. And so when Planetree was founded, the founding board said, we want a name that's symbolic of getting back to the roots of modern medicine at a time when it was still understood and appreciated that the healing journey for the patient is not just about the physical nature of the disease. It's also about the healing journey of that patient's mind and their spirit. It needs to include a more holistic approach, and the healing temples back in Hippocrates' day were just that. They were these wonderful healing environments where a patient went, their family support system often went with them. There was music, there was artwork, it was often out in a beautiful natural setting. And so all of those elements were understood to be a part of what lifted the patient's spirit and helped in the healing process.
How many Planetree facilities exist?
Probably about 150 sites at this time, and that includes mostly acute care hospitals, but a growing number of physician practices, continuing care and skilled nursing facilities. And it's really beginning to branch outside the United States, and there are quite a few organizations now in Canada and the Netherlands in particular that have adopted the philosophy.
Describe the business case for Planetree patient-centered care.
Well, that is another area that's really been growing, and I could address it from a number of different perspectives. Certainly the perspective that we have traditionally come from is that of the patient's experience and their satisfaction with the way that care is delivered. And so we know with the organizations that we work with who embrace a patient-centered approach to care, one of the most notable changes is their patient satisfaction rates increase. Going along with that, staff satisfaction also increases, and that has a real economic benefit in terms of reducing turnover and increasing retention of employees, which is certainly important these days. So there's that satisfaction angle. And then the other thing that we're beginning to see as more and more of the organizations that we work with begin to do their own little research projects on the impact of adopting a patient-centered model of care. For instance, there was just a study done at one of the SHARP facilities out on the West Coast, and they're a part of a system, and one of their hospitals is a Planetree hospital, has used the model for 5 or 6 years now. And they did a comparison of length of stay and cost per case for certain orthopedic surgery procedures at their Planetree versus their non-Planetree facility, and found that length of stay and cost per case were less at the Planetree facility. So we're beginning to also get some of that sort of cost data as well that's pretty compelling, but it's still early.
Dr. Frampton, tell us a Planetree success story.
My gosh, a Planetree success story. Well, there are many of them, but I'll tell a bit about the organization that Planetree is actually headquartered at, because they've used this model for quite a while, and it's been an interesting journey for them. Griffin Hospital is a small community hospital located in southern Connecticut, and they were actually a failing hospital about 12, 15 years ago. They are in a very competitive medical marketplace. They're surrounded in all directions by 7 other facilities, most of which are larger. Broader scope of services includes some really heavy hitters like Yale New Haven Hospital. And so they were having a great deal of difficulty in the late 80s, early 90s, even envisioning how they were going to keep their doors open for their community. And I think because they really felt that they needed to do something radically different, they were very open to what was then a pretty unusual approach to care. And they went out and they actually saw one of the model site hospitals for Planetree, because Planetree started really as an experiment at 5 different hospitals around the country. And they saw one of these. It was a community hospital setting out in Oregon, and they said, wow, this is what our patients and our staff have been telling us they want to see implemented in our hospital. And so they joined Planetree at that time, and they went through the assessment process for the organization, and they implemented a staff education and training program. They got their nurses very much involved with this, their medical staff very much involved. In fact, they did an interesting little program to help educate and bring along the physicians who had limited time. They had something they called the Adopt a Doc program, and each of the nurses on staff agreed to adopt one of the physicians and take the time to help them to better understand what this whole transition to a patient-centered model was going to mean for their practice. So it went very, very well, and within 3 to 4 years, they saw just an amazing turnaround, particularly of their patient satisfaction. It had been down in the low 80s in terms of percentage of patients who were very satisfied with the experience, up into the high 90s. And they have maintained some of the highest patient satisfaction rates now in the entire country. They were a part of the HCAHPS national pilot that was done, and that's a movement to standardize patient satisfaction surveys done in hospitals throughout the country. And they were the top performer in that pilot. So they were able to use this model in a way that just totally changed the way care is provided. They also have some of the highest staff satisfaction now. They used to have problems recruiting and retaining staff, because obviously if you could work at a prestigious hospital that had more resources, why wouldn't you choose to do that as a physician or a nurse? And that has totally turned around as well. They are one of the few hospitals that are on the Fortune 100 Best Companies to Work For list in America, and they've been on that list for the last 9 consecutive years, the only hospital in the country to have that distinction. So this model not only revolutionized the patient experience, but also the staff experience and the experience of their medical staff as well. And it's been a wonderful recruitment tool for them.
What is the process for implementing a Planetree program?
Well, we really begin by talking with patients, staff, and physicians. Our feeling is you don't want to take a cookie-cutter approach to something like patient-centered care, that you really need to listen to the people that are closest to the patients as well as to the patients themselves and their families. So we always start with an assessment process that includes many, many focus groups with patients, staff, physicians, family members. And we have a set of questions that helps to kind of probe a bit about what's the patient experience really like, either in this practice setting or in this hospital setting, or if it's in a long-term care center, in this long-term care center. And we get them to kind of talk about what their ideal healing experience would look like. So we do that with patients as well as with staff. We talk to the physicians about what are they hearing from their patients. What do patients say they like or don't like about the way care is being delivered? And so we really pull together some of the best thinking and ideas as well as the most important changes that people feel are necessary to improve the patient experience. And then we use that as the basis to come up with a strategic plan for implementing patient-centered practices. And we kind of roll that out over usually about a 2 to 3 year period, and there are a set of practices that are usually targeted that help to increase communication, increase family involvement, improve staff satisfaction, communications, etc. And that really forms the foundation. It's a very much staff-involved model, so staff become a part of action teams that focus on different elements and components of patient-centered care, and they figure out with some guidance, what's the best way to implement some of the changes that might be recommended. And then we check back in on a regular basis and do something that we call progress assessments, which is a lot of refocus grouping and finding out what changes have been made, what improvements are patients seeing, our staff, our medical staff seeing, and what else still needs to be focused on. And that process works very well in kind of getting that foundation of a good patient-centered culture in place. And then the challenge, like any challenge, is maintaining that. And I think that's where being part of a membership network of these 150 other sites that are all focused on the same thing, how do we continue to raise the bar for patient-centered care, they really help to sort of infuse each other with new ideas and new approaches over time to help to maintain that culture change.
Dr. Frampton, thank you so much for joining us to discuss the Planetree model of care.
Thank you. It was a pleasure.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions at reachmd.com, which now features on-demand podcasts of the ReachMD library. Thank you for listening.